everyone. I just wanted to review briefly the next writing assignment that's coming up, the case study, which is really your opportunity to put on your therapist hat and apply lots of information that you've already acquired so far this semester and learn some more. So just where you find that is, of course, under writing assignments on D2L. If you scan down here, the case study is right here. I'm just going to open that up first, and we can take a quick look at the assignment itself. So it's a 50-point assignment. The purpose, again, is to understand the process, again, as we've done all semester: assessment, diagnosis, and treatment. Individuals present with many symptoms, lots of stories, many of which do not really point to the main issue. And at times we do play like detectives as therapists to conceptualize what is really going on for this particular client. And that's exactly where you'll come in. You're going to choose a case study of 10 different options that you have on D2L. I'll show you where those are. Find one that you're more interested in. It can be, some of them will be categories of disorders that we've already reviewed, and some will be the ones that we haven't gotten to, but that, of course, is up to you. The assignment is a 3-page requirement. You're going to have to introduce, the who, the what, the why of the client. The term we use is a clinical picture. How is this client coming together? How are you starting to envision or picture this client? And remember, I'm going to give you lots of creativity in here because these are short case studies. There's not a lot of information, but certainly enough to make an accurate assessment, diagnosis, and treatment plan from. But you can add some history if you think that's necessary, or that would certainly make the paper more interesting. But I'm going to give you some creative ability to take that a little bit further than just the information that I presented to you. Number 2 is a list of symptoms and criteria. 3, how is this affecting your client, right? Is it this occupational, academic, family, relationship, socially? We're going to look at those 4 Ds a little bit, probably there. And then choose a DSM-5 diagnosis. So it's pretty basic what you're going to be doing here, but I also want you to just think about the assessment process as a 3-step process, right? So the assessment phase, right, is how are you assessing this client, right? How are you going to do that? Are you going to interview them and or run some tests, give them a depression inventory if you're suspicious of depression? Are you going to do a survey? Again, how is that assessment? Are you going to use projective testing? Again, always think multiple ways to assess. The next is the diagnosis, right? So diagnosis, remember, we could have dual diagnosis, many, several. Certainly, of course, with anxiety disorders, we do see those run in groups. We call that comorbidity. A lot of people with depression have anxiety and vice versa. Somebody with schizophrenia is most likely going to have other disorders as well, so think broadly there. And then lastly, in the treatment phase, how are you going to treat this individual? Are you going to do individual therapy, couples maybe, depending on the issue? You're going to do family therapy, or all of the above. Are you going to treat it with medication? And always remember, in the treatment phase, you're looking at the models that are informing your behavior, because if you're going to look at a more cognitive behavioral approach, you're going to do cognitive behavioral therapy, for example, think about the model. What does that model say? If you're going to use more of a psychodynamic, psychoanalytic approach, what does that model say and inform the questions you ask and the plan you put together? So have some fun with this. It's really a great example, or a great opportunity, rather, to come up with a really interesting case study and come up with your assessment, diagnosis, and treatment. And then the treatment plan information is here. The rubric is pretty simple. Introduce your client, list of symptoms, how is it affecting your client, your DSM-5 diagnosis, and your treatment plan for a total of 50 points. And then lastly, I just want to go back here to the writing assignments module where the paper is. So if you look under case studies, here's your paper, but then all your case study examples just sit right below it. So there's a assortment of 10 different case studies. Again, it's not going to be hard to look at it quickly, but again, spend some more time because there could be some things hidden. And again, have some fun with this. Put your therapist hat on and just come up with a really great assessment, treatment, and diagnosis, which would be a really great thing for you to be able to do at this point in the semester. Give me a buzz if you need anything. Send me an email. Talk to you soon.